Doc. Here's a Invisalign case that you had some questions about, specifically on the timing and maybe the complexity of the case. It looks like the setup has already been done, so I'll share a few thoughts with you. So one of the things you did, and I do agree, is you lock the molars into place. In general, I find this to be a good strategy if and when we don't plan on sagittally moving. I say sagittally, if we don't plan on moving the teeth at all. In this case here, we're happy with the sagittal position, but we're also happy with the overjet, that the posterior overjet. Sometimes I'll buccalize these upper molars a little bit, or really the whole posterior segment, if I find that the overjet is inadequate, just to create some more freedom in lateral excursions. And a lot of that depends upon the degree of canine guidance that's there. Needless to say, good canine guidance, maybe a millimeter of posterior overjet, I don't really see the need of moving these back teeth. Part of the reason why that's advantageous is you could imagine that if these teeth stay still, especially being multi-rooted, that they're going to be excellent anchors. The more that we move teeth, in theory, the more that we soften the concrete around the anchors, maybe the less stability we have anteriorly. That's not necessarily something that's been studied. That's just kind of a hunch of mine. In general, I don't want to move back teeth if I don't have to. In this case, we don't have to. I would say less than 20% of cases I do this on. So it's not super common that somebody's going to present with such ideal posterior occlusion and need for anterior only. So this patient is really just an aesthetic only patient. He doesn't like his lower crowded teeth. So it's pretty straightforward case if we just want to straighten them. But as we can see, the patient has a step occlusion or exaggerated curve of Spee. We don't always want to correct this. One of the goals in orthodontics is to level the curve of Spee most of the time. But if you look at his upper teeth, let's just ignore for a moment the lower teeth. If we look here and we ask ourselves a question, are these upper teeth in the right position from an incisal-gingival dimension or kind of vertical dimension? I'd say yes. The cervical margins of 8 and 9 are relatively on plane with 6 and 11. You have the normal step down between the canines and the first premolars. So although we need some alignment of the arch, I don't think we need a whole lot of extrusion to these teeth, which is good because extruding teeth sometimes can be challenging. The reason I share this is because when we answer that question, then we can say, how much leveling of the curve of Spee should we do? In this case, I think we should level the curve of Spee. As you can see, if the upper teeth are in a good position, the lowers are locked in. There are times when it's the other way around. So going through this algorithm is helpful to make sure that leveling the curve of Spee in service of just trying to achieve that goal is not inappropriately assigned to the case. In this case, it's an appropriate treatment goal. Leveling the curve of Spee, lower curve of Spee. So we idealize the upper, that's basic facially generated treatment planning concept applied to orthodontics, and then we make the lower teeth match that. In order to do it, the best way to level the curve of Spee is to intrude. I'm going to modify the plan here. Modifications with 3D controls are temporarily unavailable. That's interesting. Let me refresh it. So while I'm refreshing this, the physical parameter or physics concept that comes into play here is for every action is an equal and opposite reaction. Let's see. There we go. All right. So if we intrude the lower teeth, if there's a force pushing down on these lower teeth, the tray is going to want to have a reflexive action to come up posteriorly. That doesn't always happen depending upon the shape of the teeth, but one of the things that we can do to help ensure that we don't have tray unseating is to place a 4 mm horizontal attachment on the first molar as high as we can. In general, when you're placing attachments, you want to go as high as possible because it grabs more of the tray. You can imagine if the attachment was down low, the trays have more chance of deflection here, so you have less kind of intimate relationship between the attachment and the tray. To double check to make sure I have space here, I'll do this. Something to that effect. Then do the same on the other side. So even though these teeth aren't moving, we're using these horizontal attachments as anchors. Apologize for the kids in the background. All right. Then, depending upon whether we want to open the vertical or not, a lot of times these cases we want to increase the vertical. I might actually extrude this tooth as a way to counteract the intrusive force anteriorly. This case here, I don't think we need to do that, but just know that there's something in the ortho world called meow mechanics, which is using a wire. It's a reverse curve of Spee wire to extrude the posterior teeth and intrude the anterior teeth at the same time. Just to show you what I mean. Let's go ahead and unlock this, make movable. Then I'll extrude this a little bit. By putting these upward forces here in the trays, we counteract the intrusive forces here. This is probably not necessary, but I think it won't hurt. And if anything, it just shows you the concept. And I have a bunch of other videos on this technique on the channel. All right, so that's kind of setting up the posterior segment. And then always, when we want to intrude teeth, we're going to over-treatment plan. So I'm going to do something like this. You could imagine a tray pushing down. That's a lot of bone that the root's having to push into. So we want to overplan it. When I first started doing things like this, I used to get scared that I was actually going to get it and it was going to look dumb or not function well. I don't know how else to say it other than you just won't get anything close to this. Maybe 50% of that. And you can always stop if needed. But in my experience, that's not the case. So in general, for significant deep bite cases, I'd call that a significant deep bite, although that's a misnomer. He doesn't have a collapse bite. It's a visual deep bite case. I think the idea of kind of over intruding them is a good idea, all the way to what I say is 0 millimeter overbite. If we do all of that, what we find in the end is a very significant overjet. And this is kind of a problem. Aesthetically, I think the patient would be fine. But from a functional perspective, how do we bring in these anterior teeth into play? Well, number one would be, well, actually, before I say number one, we're not going to get that degree because we're not going to have that much intrusion. So without a question, we're not going to see this much. But let's just say we expect 50% of this, which I think would be a good estimation. We still have a lot of overjet left. So we could do IPR in the uppers. I sometimes will ask the question, would IPR achieve an aesthetic outcome? Kind of. He has very wide centrals. Maybe his laterals could use a little slenderizing. What I would say here, how I'd approach this case, is I'd leave it like this, get everything straight, and then we'll reassess after his first round of trays and determine how we want to address whatever resultant overjet is there. It might not actually be there. Again, the teeth don't move anywhere close to 100% of what we see on the Clincheck. Some movements are more predictable than others. But that's how I would handle this case. As far as the Invisalign Express, I do think that this is not an express case. To your point, we could treat this as an express case just to achieve aesthetic outcomes only. So if you want to update me on what the patient's needs are, we can go from there. I'm going to clear this out, so if you want to go through and make these changes and see how many trays, you could hit live update, but I think it'd be worthwhile for you to go through the exercises yourself. All right, keep me posted.